which means the virus is spreading fast. ICUs are already full in 54 Florida hospitals.
The biggest issue is that we have a lot of aggressive, non-compliant people. A lot of the young people are saying, so what if I get it? If I get it, it doesn't mean anything.
More Americans are being infected with this virus now, 6 months in, than ever before.
Right now, the southern U.S. accounts for about a quarter of the world's cases of COVID-19. Think about that, just the southern half of the U.S.
19 states are now seeing their highest average daily case counts ever, including deep red Alabama, which tomorrow is making masks mandatory.
I always prefer personal responsibility over a government mandate. And yet I also know with all my heart that the numbers are definitely trending in the wrong direction.
And heading to Walmart? Better bring a mask, starting next week. Oklahoma's governor also just made a surprising announcement.
I got tested yesterday for COVID-19, and the results came back positive. So I feel fine.
Just a few months back, he downplayed the virus, tweeting, then deleting a pic at a packed restaurant.
CNN's Nick Watt there. More now on rising tensions between the UK and China. Beijing has launched a strongly worded attack, saying there could be economic retaliation after Britain excluded the Chinese tech giant Huawei from its 5G telecom networks, citing security concerns. The communist government says it's not sure now if investing in British companies is safe anymore. The UK faced strong pressure from the United States not to employ Huawei. President Trump has already taken credit for the decision. The BBC's John Sopel explains.
Our desire to communicate, to have instant information, to be connected at all times, to watch and listen to whatever we want, seems to know no bounds. And the next stage of that revolution, 5G, with the Chinese telecoms company Huawei, a key element in this, is ready to go. But technology has just crashed headlong into politics. Britain, under pressure from the US, is cutting Huawei out of the picture. And Donald Trump last night was on a victory lap.
We confronted untrustworthy Chinese technology and telecom providers. We convinced many countries, and I did this myself for the most part, not to use Huawei because we think it's an unsafe security risk. It's a big security risk. I talked many countries out of using it. If they want to do business with us, they can't use it. Just today, I believe that UK announced that they're not going to be using it. And that was up in the air for a long time, but they've decided.
The days when Donald Trump boasted about the greatness of his relationship with President Xi seem from a different age. He was asked last night whether the two men would be talking soon.
No, I haven't spoken to him. Well, no, I don't. I have no plan to speak to him.
But Beijing is furious that, to use a Chinese word, Britain has kowtowed to American demands. And they're letting it be known in no uncertain terms that this won't be a consequence-free decision.
In the end, this is a big world, and the UK is only a small part of it. Ultimately, this ban won't stop Huawei from prospering. I've also stressed that China will fully and seriously evaluate this incident and take all necessary measures to protect the proper, legitimate rights of Chinese companies.
The downward spiral in relations between the US and China was underlined today, with America imposing visa restrictions on Huawei employees entering the US. Make no mistake, Washington is on a mission.
The UK joins the United States and now many other democracies in becoming clean countries, nations free of untrusted 5G vendors.
Mike Pompeo ending that report from John Sopel. Earlier this month, in a vote that pushed the boundaries of democracy, Russia voted to allow Vladimir Putin the right to remain in power for an extra 16 years. The Kremlin called this vote a triumph. But today, hundreds of people gathered in Moscow to protest the changes to the constitution, leading to scores of people being arrested by police officers in riot gear. Mass gatherings are banned in the capital because of COVID-19 restrictions. With more, here's the BBC's Sarah Rainsford.
The crowd queued on Pushkin Square in the pouring rain to sign a petition against this month's constitutional reform. The key amendment allows Vladimir Putin another 2 terms in the Kremlin, and there were chants of Putin go from the crowd. Some had written the word no on their face masks.
This so-called vote, with 70% of fake results, practically nullified the regime. Russia has to be re-established as a free and democratic country.
I'm not afraid of anything. Don't believe, don't hope, and don't ask, but do what you think is necessary. If detention happens, let it be. If they give me a fine, let it be. We'll get away with it somehow.
The protest had not been authorised, but for more than 2 hours the police stood by and watched. When a group began marching down the street, though, officers moved in quickly to detain them, grabbing people at random and dragging them to nearby police vans. The Kremlin has hailed the official result of the vote on July the 1st as a triumphant show of confidence in Mr. Putin. Protesters, though, dismissed the entire process as a farce, staged only to make sure his current term as Russian president doesn't have to be the last.
Sarah Rainsford there in Moscow. A new report by the organisation Human Rights Watch is accusing gangs in Colombia of killing civilians who failed to comply with coronavirus lockdown restrictions imposed by the cartels. The study claims violence is routinely being used to enforce safety measures across the country's rural areas. The BBC's Gareth Barlow has more.
The report, based on telephone interviews with community leaders, prosecutors and charity organisations, paints a grim picture for people living in Colombia's rural regions, where numerous armed groups operate. In the state of Bolivar, in the north of the country, a pamphlet attributed to the National Liberation Army, or ELN, claimed the group's fighters were forced to kill people because residents hadn't respected their orders to prevent the spread of COVID-19. In all, 9 killings have been attributed to armed gangs, which have carried out draconian punishments, according to Jose Miguel Vivanco, the Americas Director for Human Rights Watch. Despite the Colombian government implementing its own measures to contain COVID-19, many of the lockdowns and curfews introduced by armed gangs are more severe, hampering the ability of those under their control to access basic necessities such as food and medicine.
The BBC's Gareth Barlow. Billionaires Elon Musk, Jeff Bezos and Bill Gates are among several public figures targeted by hackers on Twitter in an apparent Bitcoin scam. The official accounts of Barack Obama, Joe Biden and Kanye West have also requested donations in cryptocurrency. Here's an example of the scam. Everyone is asking me to give back, and now is the time. You send $1,000, I send you back $2,000. That was a tweet from Bill Gates' account this morning. The tweets were deleted minutes after they were first posted, but Bitcoin records show significant amounts of money had already been transferred. Verified Twitter accounts marked with a blue tick were for a few hours stopped from posting any tweets, and Twitter says it is investigating the incident. And finally, the US Supreme Court Justice Ruth Bader Ginsburg has been discharged from hospital, having been treated for a fever and an infection. It's understood this was not related to COVID-19, but to a gallbladder problem. The 87-year-old Liberal justice has a cult-like following on the American left, and her health is closely watched by those who hope she can see out President Trump's term. And that's World Watch for today. I'm Max Toll. Mani?
Thanks, Max. And we are still in the Tangaroa lunar phase, marking the period of celebrating Matariki. We continue with our Whitu explanation. Today we have Tupuarangi, Ngā ruru te wauku, mato mato te wauku, mā puapua te puhi kai ori ori e tauai ngā tamariki a tāne. Tērā koea te puanui. Tupuarangi mai e momona ngā manu, ka momona ngā hua, ka puta, ka ora. So Tupuarangi is connected with everything that grows up in the trees, our fruits, berries and birds. The next star, Ururangi. E Ururangi whakamāriretia te atua mā tā kere pō koi pū kirikiri mai, koi hau roku roku mai, koi huripari mai. Engari ke kia hau koanga, kia ko tingi tingi, kia pūria ai au, kia whakahauoratia ai au. So Ururangi is the star connected with the winds. And that's Midday Report, te purungo o te pautūtanga for today. Hei kona.
RNZ News at 1 o'clock, ko Anna Thomas Tane. National's new leader has given top jobs to her two predecessors, Simon Bridges and Todd Muller, in a caucus reshuffle. Judith Collins revealed the new lineup this morning after senior MPs Nikki Kay and Amy Adams announced they'd be pulling out at the election. Mr Muller has been given the shadow trade portfolio with a ranking of 8th, while Simon Bridges has been ranked 4th as spokesperson for Justice and Foreign Affairs. He takes the Justice portfolio from Mark Mitchell, who has tumbled down the rankings. Two first-termers, Chris Bishop and Nicola Willis, have been promoted. The Prime Minister says the impending closure of the Bluff aluminium smelter means the government has to expedite its investment in the south. Jacinda Ardern and other senior ministers are visiting Southland today. Simultaneously, there's been a flurry of funding announcements for southern infrastructure projects. Ms Ardern spoke to reporters after meeting business and civic leaders in Invercargill.
What has been clear in the meetings today is that we are all in agreement that a transition is needed, that everyone wants high-waged, decent jobs here in Southland.
The new funding includes $25 million for flood protection projects and $25 million for a safety upgrade of the Homer Tunnel. Economic volatility associated with COVID-19 has contributed to the first fall in quarterly inflation in 4.5 years. The Consumer Price Index for the 3 months ended June fell to minus 0.5%, with annual inflation of 1.5%. It's a significant turnaround from the previous quarter's annualised rate of 2.5%. Lower fuel prices have been the main factor in the fall. Business leaders in Christchurch say the worst of the economic fallout from COVID-19 is yet to come, but some believe their city is better placed than others to weather it. Before COVID-19, Christchurch had about 8,500 unemployed people, but it's now estimated that between 9,000 and 36,000 will lose their jobs in the coming year. Property investor Richard Peebles says the city may get off comparatively lightly as it relies less on overseas tourists than other towns.
Our tourism numbers, it only just got back to where they were pre-earthquake, just before the lockdown. So we didn't have a massive number of overseas tourists.
Great.
Kia ora everybody, good to see you all again. Just a brief update today. I'm very pleased to hear reports from the Ministry that there has been a flurry of activity on the New Zealand COVID Tracer app overnight. 11,000 new registrations overnight, so if we keep that rate up, things will be looking much better. So thank you all for your help in spreading the word. The Ministry team at the Ministry, of course, remains ready to help anyone who needs it. So please download the app and use it on your phone. And if you're a business, please make sure you have your QR code on display in an accessible place for customers. We've had some feedback that it works better if it is in front of rather than behind glass panels. For contact tracing to be effective, we need to know where a person has been, not just yesterday, but a week ago, 2 weeks ago, or even longer, and the COVID Tracer app helps people to collect that data. The COVID Tracer app has an alert feature, which is an incredibly important part of the tool. Contact alerts allow the Ministry to quickly inform people who may have been exposed to COVID-19 so that they can take immediate steps to protect themselves and to protect those around them and help us to break the chain of transmission. The app has been designed to protect the privacy of everybody that uses it. Your digital diary is kept securely on your own phone, and the Ministry of Health can't access it without your permission. It's important to note those things. We'll have further discussion in due course around other things that are being explored, and I'm sure you might have some questions on those, although we're not in a position to make further announcements on that today. But I'll hand over now for the regular update to Dr. Bloomfield.
Thank you, Minister. Kia ora koutou katoa. So today we've one new case of COVID-19 to report in managed isolation. It's now been 76 days since we had a case of COVID-19 acquired locally from an unknown source. Today's case is a child of two people, both of whom have previously been reported as cases. They arrived in New Zealand from Italy on the 4th of July, and that family is staying in the Commodore Hotel in Christchurch. And I just wanted to pause there to wish the family a full and speedy recovery, and likewise to all our people who have active COVID infection at the moment. We shouldn't forget that these are Kiwis, and they have got this disease, and we do want them to recover well and fully, and know that our thoughts and best wishes are with them. We've had a further case be classified as recovered, so our number of active cases actually remains at 27 in total at the moment. Our total confirmed cases is now 1,198, and we will update the WHO on that number. And there is no one receiving hospital level care at the moment. Yesterday we did see an increase in testing, a total of 2,899 tests, of which 726 were undertaken at our managed isolation quarantine facilities. So our total number of tests now completed is 436,233. We've seen some reports on social media about people being concerned about being charging for tests, and just to reiterate the point I made a couple of days ago, there is no cost for an individual to be tested for COVID-19. We have negotiated an agreement with the district health boards and with primary care for GPs and the CBAC staff to be reimbursed. So anyone wanting advice about whether they should get a test should ring Healthline, their own DHB, or of course their own GP. Just to follow on from the Minister's opening comments about the COVID Tracer app, great to see that increase in registrations yesterday. It'd be good to see that continue. The number of QR codes on display is also continually increasing, up to 78,810 now, but still a number of businesses and organisations that haven't yet got on board. I know that a lot of businesses did try to get their QR code in May and found the process overly complex. It's important for them to know that it is now a much simpler process, and it only takes a few minutes. All you need is a driver's licence, and if you don't have a driver's licence, you can still get one by completing a simple template and emailing it to the Ministry. So check on the Ministry of Health website. And just to reiterate that the NZ COVID Tracer app and any of the similar apps that are being used in other countries, and we've seen this in Australia over recent days with their outbreaks in Victoria and then the smaller outbreak in New South Wales. The app is an adjunct to having a really good contact tracing system in place, which is what we have been working on here in New Zealand. So interestingly, if you look in Australia, they are reporting that they've downloaded information from their Bluetooth-based app as of a couple of days ago, 285 people. They didn't identify any additional contacts through that download, and likewise about a dozen downloads of the information from the New South Wales outbreak and didn't identify any additional contacts. However, the value of both the app we have and the Bluetooth functionality, which we are looking to add to our app in due course on that Apple Google platform, the value is in being able to notify people rapidly so that they can take action with either self-isolation and or getting advice about a test. So again, just a final word of encouragement of people to download the app, use it to scan. It only takes a few seconds each time you enter a premise, and that will be very helpful with our preparation, which we must all be a part of, for the likelihood of getting a community case at some point in New Zealand. Thanks, Minister.
Thank you. Just briefly before we get into your questions, a brief update on behalf of Dr. Woods and the MIQ team. Yesterday, you'll be aware that around 3:30 p.m. a fire alarm went off at the Ridges, a managed isolation facility. It was accidentally triggered whilst furniture was being moved. Fire and Emergency New Zealand responded, and the returnees were safely evacuated to the designated assembly point whilst also being asked to follow social distancing rules. Due to the large number of people evacuating from the 3 exits, there was a short time where social distancing could not be strictly followed, but the health risk is considered to be low because the returnees were wearing masks as they do when they're outside their rooms, and any contact closer than 2 metres would have been for only a short period of time. there were 154 returnees staying at the Ridges, and all have had negative day 3 tests. There has been no positive test at the Ridges for more than 3 weeks. Routine day 12 testing, of course, will still be undertaken. Facility staff saw no evidence of bubble breaking or mingling with the public when the returnees were evacuated. They were cleared for re-entry 20 minutes after the fire alarm at 3:50, and re-entry was completed at 4:30 p.m. Happy to take questions.
Mr. Hipkins, you keep talking about wanting to increase testing rates. What sentinel or random community surveillance testing, if any, is being done currently?
Look, as you see, the testing rates are starting to come back up again. The revised guidance, or the extra guidance from the Ministry of Health, was only issued sort of just over 24 hours ago, so I think we do need to give people an opportunity to respond to that. You know, I'm confident that we're going to see the testing rates increase. That's certainly the feedback that I've had, not just from the Ministry of Health, actually, but from GPs and others. But I'm happy for Dr. Bloomfield to add to that
if I can, Minister, just to follow up on your specific question. So there is no random testing happening in communities of asymptomatic people. That's something we did through the back end of Alert Level 3 and into 2, when we were trying to identify any undetected pockets of infection out there. So this community-based testing is of people with symptoms, of which there are quite a number at this time of year. So people with respiratory symptoms, and the clarity that was provided on Tuesday was which of that quite large group of people coming through general practice every day should be being tested. And that's why we agreed on with primary care, the best group was to test, in addition to those who fulfilled the high index of suspicion criteria, to test those who would be at risk of complications, so older people, people with pre-existing conditions.
So do you think there's no need for sentinel testing at the moment?
So what I would describe that as amplified sentinel testing. In fact, what sentinel testing is in a usual year we do sentinel testing for influenza, and we have a group of 90 general practices that every week swab the first 3 people they see each week with influenza-like illness. And what those swabs get analysed at ESR to look and see if the illness the person has is influenza. So what we're doing now is, of course, looking to see are the symptoms that these people are demonstrating, and on a much larger scale, are any of them demonstrating symptoms of COVID-19. So you could argue that is, or the best way probably to describe it is very high intensity sentinel testing.
And this is for either of you, but how many staff, including security and hotel employees, are working shifts at managed isolation facilities currently, and how frequently are those individuals being tested?
So there are a lot of them. I can get you a head count number if that's helpful. As I've mentioned before, I've been to visit several of these facilities now. They are highly staffed, so there are quite a few people who spread across a number of different teams, so police, defence, health staff, and of course the people who work at the hotels as well. So I'm certainly happy to get you a regular head count, if you like, of how many people are working across all of the different facilities. The testing regime is starting to ramp up for those people. As of last week, I think that the testing regime started to kick into gear to a higher level. We are going to be getting a more detailed breakdown of that. That hasn't come through yet, but again, I'll ask Dr. Bloomfield if he wants to add to that.
Yes, so we will be tailoring that testing to the different groups of staff at the facilities. For example, the health staff are there every day. They're on shifts. In fact, there's a nurse there 24/7 in every facility. A lot of the staff working in the facilities are Defence Force staff, and they tend to rotate in and out. So again, we're tailoring the testing to make sure that everyone rotating in and out is tested during their time there, and we're also looking at what other testing might be required when they rotate out as well.
So how frequently might that nurse, for example, be tested as opposed to the Defence Force personnel?
We're still working on that, but so it could be every couple of weeks, or it could be more or less frequently. We're just working on that.
Bloomfield, are you certain that there's no community transmission?
We've got no evidence of community transmission at the moment, and I think what is reassuring there is that we are now doing the testing, of course, in anyone who is in a facility, who's coming into the country. We are detecting cases there. They are completing the full 14 days, and we haven't, in our testing around the border, including around of staff at managed isolation and quarantine. We haven't identified any cases there, which is where they are most likely to spring up. And we haven't, in tens of thousands of tests in the community over the last few weeks, detected any COVID-19 cases.
You say to reports that potentially 2 people were tested positive in the community and are not, and then were moved into an isolation.
So I don't know that specific report. We did have one person who had been a case in managed isolation, had recovered and been discharged, was then assessed at hospital again, and as part of the assessment, a COVID-19 test was taken. That test was positive. He was returned to managed isolation, actually the quarantine facility in Auckland, to be reassessed by the clinician, who assessed that the positive test was a result of residual virus, which we see, and that his residual symptoms were due to an underlying condition. So yes, I'm aware of that case, but I'm not aware of any others. Again, there's very strict criteria applied before someone is determined as recovered. Once they have been identified as a case, and they are the same criteria we've applied right from the start. In fact, I asked our team to have a look at those criteria, and I got a report back yesterday to check that we were still aligned with Australia, the WHO and other countries. One of the things we are going to do is, currently we have used the definition of at least 10 days since onset of symptoms, or since a positive test if they were asymptomatic, and at least 48 hours without symptoms. We are now going to increase that to at least 72 hours without symptoms before they'll be classified as recovered.
On the COVID Tracer app, you say the value of the app is to be able to send notifications, but as I understand it, the incident at the Countdown where the man went there from managed isolation, that wasn't used as an opportunity to use that function and send out push notifications. Why was that?
I don't know whether you want to comment on that.
Yeah, I don't have specific information on that. What I do know is that Countdown sent out notified the people who'd used their one card who had been in the store during the period of time. And I've just talked with the team, and they're actually following up with Countdown, and we're going to follow up with other supermarket chains as well as Flybys and Air New Zealand about the opportunity to use push notifications out with the details they hold. All these tools are helpful in terms of us informing people. I don't have any information about whether it was considered to use the COVID Tracer app to push out notifications, or whether it was looked at, but it was found that there wasn't anyone who had been there in that period, but I can check that.
And according to my calculations, since the 10th of this month, only 1,371 new posters have been created, which isn't a lot for businesses. So more people have downloaded it, but businesses aren't sort of keeping up with creating posters. What is stopping that? Like, why aren't businesses creating more posters?
I think, as Dr. Bloomfield mentioned before, earlier on in the piece, it was more difficult to create posters, and I think some people may have just been put off by that experience and have not come back and had another go. Since then, it has been made easier, and we have seen a flurry of activity overnight as a result of the quite extensive, coverage and conversations that we had about this yesterday, and that's a really positive thing. So we'll continue to sort of push those messages out to businesses using the existing mechanisms we have through MB, for example, through the company's office, getting messages out that way. Those messages are continuing to go out. But the message really is, it is easier. So if you tried once before and were put off, have another go now. It's much easier.
So you are sort of just, are they doing enough, what am I thinking? Are they being responsible enough of creating posters, or would you urge them to create more?
Look, I would like them to do more. I think that there are some businesses out there who have got a QR code on display, but it might not be one of our QR codes. So they feel that they're doing their bit, and they maybe have not made the distinction that actually one of the official COVID-19 Tracer app QR codes is the most useful one that they can have on display at this point, because many of those other systems are barely being used now. And so it would be good, we would strongly encourage them now to make sure they've got the official COVID Tracer app QR codes on display.
Hopkins, it was announced today that a Rugby Championship was likely to be coming to New Zealand. Would those teams have to pay for their own quarantine, self-isolation, and what are the government's thoughts so far on it?
So my understanding, I've been advised this morning, that proposal sits with the Minister for Sport, my good friend and colleague Grant Robertson, and he'll ultimately make decisions on that. But yes, they would have to cover their own costs.
Do either of you know how many more New Zealanders plan to return to New Zealand and whether we'll need more isolation facilities in the coming weeks?
Look, it's one of those things where it's quite difficult to gauge how many New Zealanders may or may not be deciding to come home. And so we're working very hard with the airlines to forecast potential future demand for managed isolation facilities. The airlines have been very cooperative with us in that regard, and I hope that constructive relationship will continue.
And are we likely to need more facilities in the coming weeks or months?
Look, at the moment our strategy is on managing the facilities that we have and managing demand to ensure that we can accommodate people when they arrive. And as I've said, the airlines have been very cooperative with us on that. I think and we're not unique in this. Other countries who have similar facilities are going through exactly the same process.
So do you think we've kind of maxed out the capacity for staff to manage the current number of people?
Look, I think one of the things that I really was emphasised to me when I visited the facilities myself is this is not just a simple process of saying to someone, here's a hotel room, go and stay in there for 2 weeks. There's a lot that goes into running these facilities. There are a lot of people involved. So it's not just a question of how many hotels do we have that we can put people in. You've then got to have a whole lot of other things to support that, including the security, including the health teams, including all of the systems and processes that need to go around that as well. So at the moment, we've scaled this up quickly. We've had a period of time now to consolidate that over the last week or so to make sure that everything is absolutely robust. I think scaling it up further, if we don't have to, it would be good to avoid that. So if we can manage to manage demand so that we don't have to do that, I think that would be preferable.
On the case today, for either one of you, with the child becoming infected, what's the process for family if one does get infected? Do you move the whole family on the assumption that because it's so infectious they will all be infected, or how does that work?
Yeah, that's exactly what we do. So they move from the facility they are in into the quarantine facility, wherever they happen to be. In Auckland, that's a separate facility. And then there's a high level of suspicion that other family members are likely to become infected. So in this case, the child had been tested already at least once, if not twice, with negative swabs, but was retested again because there was a high likelihood of infection within that bubble. And this is what we saw when this virus was in the community, that most infection happens within the household setting.
Can I just take a moment too? Obviously I was not given any personal details of any of the people in quarantine, but I do want to acknowledge some of the families there. They've had quite a long stay, some of them, because where there is transmission between members of a family, that has the ultimate effect of extending the stay, often for the whole family. And so I do want to acknowledge those families. It is difficult, particularly if you've got young children, to be in that confined space for that period of time. They are making a big sacrifice for all of us, and I want to acknowledge them. It is difficult.
What's the longest someone spent in one of the facilities?
I don't have that.
I was just having a look at this yesterday, so I think it's around somewhere between 28 and 30 days. And the data I was looking at yesterday, and this was part of the memo around our classification of people as recovered, they all stay at least the 14 days, and only a quarter of them had left between day 14 and day 16. So most of those who test positive, often because of the other members of their bubble becoming infected, end up staying for quite a long period of time, and possibly up to even the whole month.
So only a quarter of people who test positive in the facilities leave in that 14 to 16 day
Had
window.
left at that 14 to 16 days. So the vast majority of them were staying at least 16 plus days, because they're often detected on that day 3, and or other members of their family bubble, if they're in a bubble, may become subsequently infected, and then the clock goes back as well. So they have to wait until everyone has had that at least 10 days since symptom onset, or positive test if they're asymptomatic, and at least 48, soon to be 72 hours symptom free.
Do they get any extra support if they're staring down the barrel of like a month-long stay?
Look, again, one of the things that I saw there was in the health team, where they were supporting people, they had a whole stash of nappies and toys and other things to keep kids entertained. And again, that's why I mentioned this, because I do want to acknowledge those families. I mean, I've got 2 young kids. Being at home for 5 weeks of the lockdown was a big enough challenge, and we've got quite a big house. So being in that confined space with young kids will be very, very challenging for those those families. The feedback that I have had from the staff who are working in the quarantine facilities is that these families have been amazing. They have been doing the right thing. You know, they understand why they're there. They're being incredibly cooperative. And so on behalf of the whole country, I want to thank them for that, because what they're doing is very, very important.
With both hats on, are they getting these children? Do they then get education facilities and that sort of thing as well? Because that is a really long time to be.
Yes, we are. You know, the packs, the hard packs of materials that we sent out during the lockdown, we are making those available to families in managed isolation and in quarantine, so that they can support their kids to continue learning whilst they're there. Any other questions? Very quiet day. Thanks, everybody. We'll see you. We're not here tomorrow, so we'll see you next week. Thanks.